This organization was started in 2015. That is when it started. And the main areas of operation were mainly for the orphan and vulnerable children, the ones who are affected and infected with HIV, AIDS. After observing children in hospital, challenges with having to meet their hospital appointments, having to get other basic needs like health. Sometimes you're not able to get all the medications. And then also attending school, having to be able to attend the clinic appointments. So realized we have challenges when we come, especially with the children who are staying with just mothers, single mothers or grandparents, or there are those households that are child-headed households, whereby they don't have anyone, they are not in school, they can't keep appointments. So this is the reason why this organization was formed, so that we can be able to cater for those children who are vulnerable. They don't have enough to be able to have those basic needs. We are having just small numbers, 20 to 10 parents, caregivers for children who are HIV positive. Some of them are doing very well on their medication, some of them are not doing so well. But the main aim of these clubs is such that they are able to form groups, and in these groups they are able to start up something, a small income generating activity, maybe improved farming practices, maybe vaccine making like what is in the background. The point is that they can get a small income. This small income can be able to support them, be able to provide basic needs, be able to keep clinic appointments. We don't want to hear these stories of, I don't have anything to eat at home, because they need to have good nutrition. So that is what it's trying to boost, such that they have an increased household income. If they have an increased household income, that means they can be able to provide for themselves their basic needs, be able to take their children to school, be able to obtain other health aspects other than just this HIV care package, because they have other things that challenge them. So we need them to be able to provide for themselves, and to be, as we can see, most in the background, most of them are women. So so that they can be independent, so that they are not relying on their husbands. If a husband goes away, or if some of them are widows, how are they going to be able to support themselves? So this is what this project has started up. We are targeting about 30 people. There are two health facilities, I should say, basically in there's one in Mitiana Hospital, that's a very big hospital, and then also here in Blair Health Center 3. So here we targeted 10 people, and in Mitiana we are targeting 20 people. The 10 are the caregivers and 20 are the caregivers, but sometimes you may find a caregiver who actually has more than one child in care. So the children may not necessarily tally to the number. It's the caregivers that we are targeting, because children are basically looking up to these caregivers to be able to be provided for a better life. At the end of these 6 months, we want to see that there's an increase in household income. I want to see a caregiver who's saying, you know what, I'm no longer missing a clinic appointment because I don't have transport. We want to hear a caregiver who's saying, now I no longer lack. At least I'm able to have 3 meals in a day. I have enough to provide for my child, for myself. I'm able to take my child to school. And obviously, when it comes to this other side of the HIV care package, we want to see that this medication is working well for them. We don't want to see a child who is no longer suppressed. When I say suppressed, I mean that because when you're HIV positive, you start taking medication. This medication is supposed to ensure that your virus goes down to a level that cannot be detected by our machines. But if your medication is not working well, then the virus can be detected. So now because we believe HIV and poverty work hand in hand. So if I'm not able to provide for myself a meal, I'm not going to take medication. That means I cannot actually swallow medication, and in the long run my virus is going to be up so it can be detected. So we want them to be able to provide for themselves means, food, be able to keep appointments, and the general outlook of their life is improved. So at the end of 6 months, we want them to be able to do that. And even as they are working and earning something out of these income generating activities, they are saving. These savings are able to help them at some point in time, at whatever time they may need the money. So this is the aim of this small project that has started just 2 months back, so that we can see that they have an improved outlook of life and an increased household income, and then also to have improved virus suppression among themselves, and generally to have a better outlook on life and live positive.